Hi there, my name's Danny Hickling and I'm a registered psychotherapeutic counsellor. And today I'd like to talk a little bit about adverse childhood experiences, called ACE, and the effect that can have on mental health. And the link between mental health and ACEs was first identified by Dr. Vincent Felicita and Dr. Robert Almer, and this was in the 1980s. 1980s running through to 1990s. And there was a huge program which was developed in the 1990s as a result and spurred on from a survey that Dr. Almer did in the 1980s, where 286 of his patients at an obesity clinic, the majority of those had an adverse childhood experience. Now, there's a few examples of what an adverse childhood experience might be. For instance, being a carer to parents and siblings, having a serious medical operation or illness in childhood, living with a parent who's depressed or unwell, traumatic loss or grief, witnessing domestic abuse, being bullied or cyber bullying, feeling unsafe in the place that you live, for instance, war zones or the environment you're in. And these are just a few. There's a whole bunch of other reasons. But one of the biggest factors that can make a difference, and also can be an adverse childhood experience, is feeling unloved and unsupported. So equally, this can also be the saviour that helps pull people through. One person that offers love and support can often make a real difference. Now, as I was saying, the adverse childhood experiences, which they kind of shortened to ACE for this conversation, are strongly linked to a range of mental health conditions in adults. Now, here's a few of the specific statistics that came out from this survey, which can be a little bit alarming, but I will say, bear in mind that with adequate help, that many of these can actually be reduced significantly. So first of all, depression. Individuals with 4 or more of these adverse childhood experiences, many of them, are 2.5 times more likely to develop depression in adulthood compared to those who didn't experience them. Now, the risk of depression increases with more of those experiences there are. So 4, it starts to increase, and it increases upwardly, exponentially from that point. Now, PTSD, it's always been thought, well, how come some people can have a traumatic experience and not be so affected, and others are deeply affected? It's found that with PTSD, people who have 4 of those experiences are 12 times more likely to experience PTSD. And those symptoms and the severity of PTSD increases with the amount of those adverse childhood experiences. So we mentioned just a few earlier, and there's lots more. And those experienced physical or sexual abuse as children are particularly vulnerable to this as well. And then if we also go on with abusive relationships, of course, it's always been known that there's often an increased risk. But the studies actually kind of cemented that in place and confirmed that individuals who'd experienced adverse childhood experience are much higher risk of developing abusive relationships later on in life. Specifically, women seem to have a higher risk. They were 3 times more likely to experience intimate violence with a partner than those without adverse childhood experiences. And then suicide attempts. According to this survey, individuals with 4 or more seems to be the kind of crux. You know, we can deal with so much, but 4 kind of really pushes us over the edge. Are 12 times more likely to have an attempted suicide at some point. And the number of adverse experiences correlates directly with the risk of self-harm as well. And as I guess we would expect, when it comes to substance abuse, those with 4 or more of those experiences are 7 times more likely to engage in heavy alcohol use, and also are at higher risk of illicit drug use as well. So those statistics really, I think, demonstrate the profound long-term effect that can happen if there isn't early intervention and help. And that's kind of what I stress. If there's early intervention and help, a lot of that can actually be significantly reduced. So obviously there's a high focus in counselling on trauma working on traumas to actually stop the triggers which can take people on to all of these different problems in adulthood. So if you'd like to know any more, and I hope you found this useful, I've also going to put a link on the bottom of this post which gives a little bit more meat to this post, and I hope you found it useful. Thanks so much. Bye.